हेलो डॉक्टर शाजिया, आवाज नहीं आई।
जी आप करें स्टार्ट।
अच्छा। Noreen Irfan, 33 year of age, having formal education up to primary, resident of Ghulamabad, 15-minute distance from hospital. She is married for 11 years. This is first consanguineous marriage of both partner. Her blood group is A positive. She is para-1 with no miscarriage, with one alive issue, one female, 10 years of age. Previous vaginal delivery, admitted through OPD one day before with a complaint of want to conceive for 7 years, feeling of mass for 4 years, lower abdominal pain for 1 year. Couple lived together since marriage, doing regular, satisfactory, unprotected intercourse with quarter frequency of 2 to 3 per week without any knowing fertility days. Her husband is a shopkeeper, 40 year of age, cigarette smoker for 15 years, smoking 12 cigarettes per day, but non-addict to any recreational drugs. He has a history of myocardial infarction 1 year before and taking medication for cardiac problem since then. Her echocardiography is 35. On echocardiography, her ejection fraction is 35%, according to my patient. Now he has a complaint of testicular swelling on one side, according to my patient, but not evaluated for it. He has no other medical illness like diabetes, hypertension, thyroid, chronic kidney disease, chronic liver disease, no history of any meningitis, spinal cord injuries, head trauma, inguinal and pelvic surgeries, testicular torsions, recurrent urinary tract infections, and tuberculosis. Her age of menarche is 13 year. Her menstrual cycle, previous and present 5/30, regular with average blood flow, with no history of intermenstrual bleeding, dysmenorrhea, dyspareunia, postcoital bleeding, and pap smear never be taken. Couple practices barrier method for 3 years, 7 years before, after first female baby was born. There is history of feeling of mass for 4 years. Which was gradually in onset, slowly progressive, not associated with indigestion, dyspepsia, heartburning, dysuria, urinary retention, constipation, tenesmus, hemorrhoids, and leg swellings. There is no history of weight loss and anorexia, no history of something coming out of vagina, no history of headache, chest pain, flanks pain, hematuria melina. There is no history of lower abdominal pain. There is a history of lower abdominal pain for 1 year, gradually in onset, dull in character, intermittent, radiating to back and legs, aggravating with physical work, relieved by oral medication, and not associated with fever, dysuria, burning micturition, vaginal discharge, diarrhea. There is no history of evening rise of low-grade fever and night sweats and TB contact. No history of intrauterine instrumentation, pessary on thigh insertion, and there is no history of heat and cold intolerance, weight gain, hirsutism, acne, headache, blurring of vision, and galactoria. For secondary subfertility, she never did any blood test for ovulation on 21 day. There is history of ovulation induction 4 years before for one cycle, and 13-day follicular tracking ultrasonography was also done, which showed normal dominant follicle according to my patient. Husband semen analysis was not done up till now. No test for tubal patency was done. She was first evaluated for her problem of feeling of mass 1 year before from some local doctor, where ultrasound was done, and she was prescribed some medications for the pain and was referred to tertiary care for surgery and was told the mass in the abdomen on ultrasound. She came here 2 days before. After admission to this hospital, her blood and urine reports were done, which was normal, and ultrasound was also normal, which shows a mass in the abdomen. She was consulted about surgery and 3 to 4 unit of blood arrangement, but not consulted about the benign and malignant nature of the disease and complications of surgery and post-op further workup. Her surgical history is insignificant. She has no history of diabetes, hypertension, thyroid, and chronic illness. No family history of carcinoma, ovary, breast, endometrium, colon, rectum, and fibroid. No family history of diabetes, hypertension, thyroid, chronic kidney disease, or other chronic illness. She is non-smoker, non-addict, and appropriate diet and sleep with normal bowel and bladder habits. She belongs to a family of low income. Her husband is a shopkeeper with monthly income of 20,000. Fulfilling her basic life necessities very difficulty. A young lady of BMI 27 kilogram per meter square, well oriented in time, place, and person, sitting comfortably on couch, answering my questions very cooperatively, with pallor, chylomicria, clubbing, cyanosis, jaundice negative, having pulse 80 per minute, blood pressure 120 by 80, temperature 98 degree Fahrenheit, respiratory rate 16 per minute. All accessible lymph nodes and thyroids are not enlarged. Breasts are bilaterally symmetrical with no lump in any breast quadrants. Nipples are everted with no abnormal nipple discharge seen. Trachea is central with normal vesicular breathing with no added sounds in all lung fields. Lung bases are clear. First and second heart sounds are audible with no added sounds. Apex beat felt on left fifth intercostal space, medial to mid clavicular line. On per abdominal examination or inspection, abdomen slightly protuberant, with the moving with respiration, with centrally placed inverted umbilicus. Hernial orifices are intact. On palpation, soft non-tender abdomen. A 28-week size mass felt in hypogastrum, umbilicus, right and left lumbar region with irregular margins, firm in consistency, smooth surface, mobile from side to side, lower limit not reachable. Flanks are resonant on percussion. No visceromegaly, no bruit. On pelvic examination, on inspection, normal pubic hair distribution, vulva vagina healthy. On speculum examination, cervix normal looking, no discharge seen coming out from the cervix, vaginal walls healthy. On bimanual examination, uterus was 28 week size with irregular margins, firm inconsistency, mobile from side to side, smooth surface, overlying smooth surface, and bilateral adnexal clear. Summary of my case is 33-year, para 1 with no miscarriage, with a presenting complaint of want to conceive for 7 years, feeling of mass for 4 years, lower abdominal pain for 1 year. And her husband is a cigarette smoker. He is a cardiac patient taking medication for it, or on echocardiography, ejection fraction 35%, and has a complaint of testicular swelling on one side, which was not evaluated. On bimanual examination, uterus 28 week size with irregular margins, firm inconsistency, mobile from side to side, smooth surface, overlying skin not attached to mass, and bilateral adnexa clear. Provisional diagnosis of my case is para 1 with no miscarriage with abdominopelvic mass due to fibroid uterus. अच्छा मैम मुझे इन्वेस्टिगेशंस चाहिए पहले.
और भी कुछ बता लो यार.
मैम मुझे इन्वेस्टिगेशंस में ब्लड ग्रुप विद आरएच फैक्टर चाहिए.
ब्लड ग्रुप है पॉजिटिव.
Full blood count hemoglobin in gram per deciliter with recent date. Hemoglobin in gram per deciliter with recent date.
Hemoglobin 12 gram per deciliter, TLC platelets normal.
Urine DR dipstick report, microscopy में I want
normal
pus
urine
cells.
complete examination.
Hepatitis B surface antigens and anti-HCV.
Negative.
Random blood sugar level.
130.
130.
G.
Husband semen analysis.
What you need on husband semen analysis?
I want to see volume, semen volume, and concentration, sperm concentration.
Volume
per
2.5 ml per ejaculate, and sperm concentration is 150 million per ejaculate.
And forward motility, progressive motility of the sperms, and total
motility is 20%. Total motility is 25%.
And morphology?
10% normal morphology.
Total sperm count per ejaculate?
150 million per ejaculate.
Okay. Ma'am, if there is a general physical examination done in hospital for her husband?
No.
Okay, 21-day progesterone.
What do you want to see on general physical examination of male partner?
I want to see genital assessment, testicular volume, consistency, or any abnormality, lump or varicocele, as she has a history of testicular swelling on one side for 1 month.
Okay, no examination done.
Okay, her cardiac record or echocardiography of her husband or medications he has taken.
Why you need echocardiography of her husband?
As he is a cardiac patient, and I want to confirm I want to see cardiac medicines which will affect her the semen quality,
Which cardiac medicines affect semen quality?
as a beta blockers if he take which cause sexual dysfunction.
Is she having sexual dysfunction?
No.
What is difference between sexual dysfunction and poor semen analysis or abnormal
In
semen
sexual
analysis?
dysfunction, there is ejaculatory problems or erectile problems, and semen quality on semen sperms count and इसकी motility वगैरह.
He is taking no treatment.
Okay, ma'am, 21-day progesterone.
Day 21 progesterone is normal.
Any follicular previous record, as she has taken 4 years before ovulation induction. So I want to see follicular tracking ultrasound.
If she is ovulating now, then why you want to see ovulation at that time? No record available.
Okay. For tubal patency, husband's stereosalpingography.
HSG not done.
I want to see abdominopelvic ultrasound. In abdominopelvic ultrasound, I want to see uterine size, any mass, its origin, and myometrial pathology, endometrial pathology, its regularity, and any focal lesions, and adnexal pathology.
Ultrasound will discuss later.
Okay, and abdominal भी बाद में ही बताएंगे.
Yes.
Abdominal ultrasound. Okay.
What is your differential diagnosis?
My differential diagnosis is a fibroid uterus and any ovarian mass, may be benign or malignant.
Any other problem in your patient?
Other problem means other differential. अदर डिफरेंशियल में मैम कोई रेटोपेरिटोनियल आ सकते हैं मैसेज.
Is fertility her problem or not?
Yes, subfertility, secondary subfertility is a problem.
Then what will be your differential diagnosis?
My different secondary मैम प्रोविनल डायग्नोसिस बता दूं.
Differential.
Abdominopelvic.
No, differential. Hello.